Welcome to Dennis Insider. Today we're going to talk about some smells, some nose, and paranasal sinuses. So in the beginning, we can talk about the function of the nose, or just basic about the nose. Second, we can talk about the external nose, or the external structure of the nose. Then we will talk about the openings and the structures in the nose, so the conchas and the meatus openings. And then we will talk about the four sinuses. And then lastly, some blood supply from both the internal and external carotid. The function of the nasal cavity. So first is respiration, second is olfaction or smell. It filters the air, humidifies the air, warms the air, and produces some secretions. Now, just a quick review here. We have the nose, we have some frontal sinus here, we have the sphenoid sinus here. We have some ethmoidal air sinuses that are going into these conchas. So these big bumps are the conchas. The line that I'm drawing, or the space underneath them, is called the meatus. So this is the meatus. And let's jump into it. So some structural features of the nose. We have the bone here. Okay, so in the bones, we have the nasal bone, we have the nasal part of the frontal bone, and the frontal process of the maxillary bone. We have three cartilages. We have the lateral cartilage, the medial cartilage, and the major alar cartilage. And then we have the fatty tissue comprised of that. So here we have the ala of the nose, the wing, we have the middle part, which forms the medial nasal septum. Next, now we talk about the skeletal of the nasal cavity. So first we will talk about the roof, then the floor, then the lateral, and then finally the medial nasal septum. So here, if we talk about the floor of the nasal, we have the nasal bone, we have the frontal bone, we have the cribriform plate of the ethmoid, and the sphenoid bone. The floor, which becomes a palate, is what makes up the palate. Palate is made of the palatine process of maxilla and the horizontal plate of the palatine bone. So that is the bottom here. So we did the palate, we did the roof, which is made up of a lot of bones that make up the roof, going all the way from the nasal to the frontal to the cribriform, and then all the way back to the sphenoidal bone around the sphenoid sinus. Laterally is where we have a lot of things happening. So we have the conchas laterally. So we have the superior and middle concha that comes from the ethmoidal bone, whereas the inferior concha is on its own, does not come from any bone. Then we have the lacrimal perpendicular plate and the medial pterygoid plate of the sphenoid bone. Now, medially, which is also, we can call it the nasal septum, is made up of the septal cartilage, the perpendicular plate of the ethmoid, and the vomer. So here we can see the, let's see, medial. So here we have the septal cartilage in the middle. We have this fatty tissue on the bottom. We have this cartilage in the middle. So this is all the nasal septum. This is all forming the medial aspect, whereas the conchas give us the lateral aspect. So let's do a quick review here. So once again, we can see the septal cartilage, we can see the alar cartilage, we can see the fibrous connective tissue. We have the medially, we have the nasal septum. Laterally, we have the lateral nasal wall. Here's some landmarks. So once again, the floor is made up of the palatine bone, palatine process of maxilla, as well as the horizontal plate of the palatine bone. The roof is starts from the frontal bone to the cribriform plate to the sphenoid bone. And then laterally, we can just see the superior and the middle concha, superior and middle that came from the ethmoid bone, and then inferior nasal concha that came from its own. And they have their respective openings there. Going here, we can go more. So we have the infundibulum, which we find in the middle nasal concha. We have the semilingual hiatus, which is the opening, and then into the infundibulum, which is like the canal, and this is where a majority of the openings will come out from. Now, if we talk about the relationship to this, to the nasal cavity, we know superiorly we have the frontal lobe, the olfactory bulb that comes through that cribriform plate, and the frontal sinus is on top. Inferiorly on the bottom is the oral cavity. Laterally, you have the eyes and the ethmoid sinus and the maxillary sinus. And then posterior in the back, we have the choana, or the nasopharynx, and the sphenoid sinuses. And that's how sphenoid sinuses have the opening into the either superior, middle, or inferior meatus. So now talking about the openings, we will start from the number one. The sphenoethmoidal recess is the one up here, up at the top, and this provides the sphenoid sinus opening. Then we have the superior nasal concha up top, but it has its the meatus underneath it, and the meatus here, number two, will give, or number three, in our case, number three will give us the opening of the posterior ethmoidal sinus. So this is kind of weird in that sense that the posterior ethmoidal sinus will be up top here in the superior meatus. Um, the bulla will get the middle, and then the back will get the interior, or the infundibulum will get the interior. So the anterior, middle, and then posterior up. If that makes any sense. Um, so let's keep going. So then we have the middle nasal concha that we can see right there. And then the middle meatus, you get the bulla, which should be right here, giving you the middle ethmoidal sinus. And then the infundibulum, which will give you your interior ethmoidal sinus as well as the maxillary sinus. And then inferior meatus is right here. And then underneath that, we have the, that's inferior concha. Underneath that, we have the meatus. And the only thing here is the nasolacrimal ducts. That's number 7 that go in that space. Um, Talking about some structures in the nasal cavity, we start from number 1. Here we have the nasal vestibule, which is the opening nasal vestibule. Number 2 is the limma nasi. Limma nasi splits the layer between the cutaneous and the respiratory epithelial, or the hair and the skin. Then we get into the atrium itself. So this is the atrium in front of the middle meatus, and above that we have a bump. And the bump we called it the agar nasi. Here it was limma nasi, where the hairline is, and here we have agar nasi. And then after that, you just go into the olfactory sulcus. Coming back, we talked about the 4 paranasal sinuses. So we have the frontal sinus here, we have the sphenoid sinus here, we have the ethmoidal sinuses, and then the maxillary sinuses. So the first one that's present is always the ethmoidal sinus. It's present at the birth, and it starts pushing space basically on both sides, interior, posterior. The Anteriorly, then it will form the frontal sinus. Posteriorly, it will form the sphenoid sinus. So the frontal sinus comes from the ethmoidal, like we said, and it has the frontal nasal duct that opens into the middle meatus. Then we have the sphenoidal sinus. Sphenoidal sinus is right behind the superior concha, and it has the sphenoethmoidal recess that drains into that space above the superior concha. And then finally, maxillary sinus is right under the eye, or in the maxillary region, and it drains into the infundibulum, which is situated in the middle meatus. Um, Carrying on, we talk about the blood supply in this region. So blood comes from the internal carotid as well as the external carotid. Internal carotid provides the ophthalmic nerve, which splits into the anterior and posterior ethmoidal and gives blood to the nasal wall septum. So that's internal. External comes is a branch. The terminal branches are maxillary and facial. So the maxillary will give you the sphenopalatine, the descending palatine for the palate, the infraorbital greater palatine, sphenopalatine, and then pharyngeal arteries. The facial will give you the septal branch of the superior labial, and then the lateral nasal. And then this is important because a lot of these arteries can meet in one area, and that's what we call Keisel box plexus is where most common nosebleeds happen because these 4 arteries kind of collide in that specific area. So those are the anterior ethmoidal, and anterior ethmoidal, we remember, came from the internal carotid. That's the internal carotid. Sphenopalatine came from the maxillary, so that's external carotid. Greater palatine came from the maxillary, so that is external carotid. And then septal branch of superior labial came from the facial, and that's from external carotid. We only have one branch from internal carotid. Next, we talk about innervation. Innervation is easy, is that we draw this imaginary nasal line that runs from the middle of the nose to basically the eyes, and we say everything above is V1 and everything below is V2. So V1, you get the olfactory nerve filaments, and then V2 is the anterior ethmoidal nerves. So that's how general temperature and pain, touch temperature is basically innervated. Then if we talk about below, and that's V2, and that is where you will get sensory, mostly in those nasal concha spaces. So once again, here we have just a summary that above nasal line we have the V1, below the nasal line we have the V2. The V2, the way it travels, you have the maxillary division that comes out of foramen rotundum, gives you the posterior superior alveolar, the PSA. Once it goes inside the inferior orbital fissure, we call it the infraorbital nerve, and then it will give you the remaining MSA and ASA. These are important for the molars, the posterior PSAs, and these are mostly for the premolars and the incisors. Finally, the sinuses have their own innervation here. So you have the frontal sinus that gets from supraorbital, ethmoidal that gets from the anterior posterior ethmoidal, sphenoidal gets it from posterior ethmoidal. We have some parasympathetic innervation that increases the mucus secretion, sympathetic that decreases the mucus secretion.
da, da,